Do you think that our existing mental health care infrastructure has the capacity to deal with the long-term problems from this pandemic? And what kind of solutions are being discussed, in my edition here, if they're being discussed at all right now?
Yeah, so I'm going to say no, 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 and absolutely not. We didn't have the appropriate infrastructure before the pandemic even hit. So now we're way underwater.
The degree to which there's a mental health crisis in this country, people have no idea. At the peak surge, how many Americans were talking and terrified that when they get sick from COVID, will there be a ventilator for them? Like, will there be a ventilator for me? That was a common question. Will there be an ICU bed for me? Everyone's talking about ICU bed strain. No one has or will anytime soon talk about, will there be an acute care psych bed for me? Will I have access to a therapist when I need one? Will I have access to a psychiatrist? And yet that is it's an immense problem. I'm sorry to be so pessimistic, but it just goes to show how important the center is.
One of the big pieces that we're missing in having this remote education has to do with access to mental health for children, because there are so many kids who actually receive a lot of mental health care through school counselors. And those services, most of them are really not starting up, or are slow to start up, or are harder to be able to provide. And kids are not being identified in the same way that they would if they were in school.
What do you think might be some of the long-term effects on children when they miss that social learning aspect of their education? Is it too early to tell?
There are going to be long-term effects. And they're going to go on for years, well beyond when people are able to be back into classes. We just don't know exactly what that's going to be. But we know that there are implications for people who are living with long-term unmitigated stress. We know that there is an impact, there are physiological and psychological impacts to living with a feeling of trauma. And many people are really experiencing a lot of what we're going through now in the same way as they would other kinds of trauma, where there's a feeling of fear that people are carrying, where there's a feeling that that they could make a wrong move or a wrong turn. And parents are really struggling along with that. Do I let my child go into a classroom where I know that they could have the benefit of that social environment and that learning environment, but do I put them at risk? Do I put me at risk? Do I put the grandparents at risk? And carrying the weight of that is really taking a very strong toll.
And what about the racial protests on top of this? I mean,
yeah, I think it's again, these are things that happened before COVID happened, with the racial sort of discrimination that is inherent in our community. But this is like an acute on chronic kind of stressor. The way I think about it is racism, the stress of being Black or brown or exposed to healthcare disparities is already an underlying level of stress. So the protests happen on top. So you have some folks who are probably just blocking it out, right? Or who might be a little bit dead inside, as if we're using that terminology, because it's just so much more to contain, or you're used to it, right? You already know that you're not surprised by these things happening. I might say that I'm in that category. But then you have some folks who it's just continuing to break them down and break them down and break them down. And I know it's not a direct correlation, but that additional stress does weigh on your ability to take care of yourself and to function daily. So I'm seeing it sort of across the board by some folks who are either not really letting it get to them and they're like, well, I'm not surprised by this. This is the way that it is. It's always been, and not participating. And I've seen some folks who are either really depressed or angry with what's happening, and then folks who are letting it impact their mood and they're a lot more depressed and unable to sort of get out of bed.
Can you talk a little bit about the direct and possible psychological effects of having COVID?
Yeah, definitely. So in the ICU, there is a pretty good understanding about the post-intensive care syndrome, which means that after you go through critical illness, COVID or anything, there are long-term sequelae that you don't really notice unless you're looking for it, that have to do with cognition, depression, PTSD. And I think COVID really accentuates that. So it's hitting you in all these different ways. And on top of it, there's more and more evidence that COVID affects every organ, and the brain is not spared from that. And so many people who we're calling like the long haulers are really just this post-intensive care for ICU purposes. They clearly demonstrate sort of long-term issues with cognition. They're not able to function. I know people who had COVID long ago. Yes, they can't yet climb up the stairs in their house. They also they just can't think clearly. So I think that there's profound ramifications that we're only slowly learning about. And that is going to be another level of strain on the system that we're not ready for.